In 1990, the world of medicine changed forever. That was the year that Dr. Dean Ornish wanted to find out, can we not just prevent heart disease, but can we actually reverse it? Can we open up arteries that have been clogged by years of bad diets and unhealthy lifestyles? Well, Dr. Ornish brought in people to his study. They already had moderate to severe heart disease, and he asked them to do just 4 things. First of all, he said, let's follow a vegetarian diet. Now, why would you use a vegetarian diet in patients who have heart disease? Okay, you want to avoid the animal fats, you want to avoid the cholesterol, that makes sense. Also, no smoking. Try to reduce stress, which is why he didn't do the study in Washington, D.C., where I live. And modest exercise, about a half-hour walk every day or an hour 3 times a week. That was the whole program. No medications, not even cholesterol-lowering drugs, no surgical procedures, no stents, nothing. Just simple diet and lifestyle changes. The results were astounding. First of all, their chest pain went away within weeks. Secondly, as the weeks went by, people started losing weight. Now, some people were already thin. They didn't lose any weight. But some people had a lot to lose, and the average person in Dr. Ornish's program knocked off 22 pounds in the first year without any calorie counting at all. What really made medical history was everybody came back into the hospital, and they had an angiogram. That's an X-ray of the heart that shows you that little trickle of blood that gets through to the heart muscle. And they showed that the arteries were actually opening up again. I'm talking about arteries that have been clogged by years of accumulating plaque. They were actually opening up again, that you could see a measurable difference in 82% of the patients in the first year. And it doesn't matter how old you are. When you emphasize the right foods and you avoid the ones that are causing the problem, the results can be life-changing. Now, let's understand the enemy. I want to take a look at what happens when artery blockages form. Artery blockages begin when cholesterol particles irritate the artery wall, and if one of those accumulating blockages breaks open, it can trigger the formation of a clot. And if that clot occurs in your coronary arteries, the arteries to your heart, that can kill a section of heart muscle, and you have a myocardial infarction, a heart attack. If this occurs in the arteries to the brain, the carotid arteries, you can have a stroke. If this happens in the arteries to the legs, you'll have leg pains called claudication. Or if this happens in the arteries to a man's private parts, you have erectile dysfunction. Did you know that? That erectile dysfunction, that is so common, as you can see when you watch television commercials, it is very often, for many men, it's a sign of artery blockages. Here's another surprise. Common lower back pain may be a sign of artery problems too. Think about your spine. Your spine is bony vertebrae, one on top of the other, and between them are little discs. The discs are cushions that keep the bones from just bashing into each other, right? Well, the very first place that artery blockages form is not in the heart, it's not in the carotid arteries to the brain, it's in the lower aorta that nourishes the spine. Your heart gives off the aorta, that comes up and then down, it goes right down along the spine, it gives off little arteries that go to nourish every level of the spine. The very first place where the artery blockages form is right there where the arteries lead to the spine. Researchers in Helsinki, Finland, did something that other researchers hadn't thought to do. They did autopsies on people who had died of various causes, and they examined their spines, and they examined the arteries that lead to the spine, and the results were astounding. The average person with a history of back pain had 2 arteries that were completely blocked and 1 more that was narrowed but not blocked. And the people who hadn't reported back pain had fewer blockages. So the point is this. If my back has lost its blood supply, then the wear and tear in those discs has no opportunity to heal. So it's like a pillow that just gets fragile and it breaks open, the stuffing comes out, it presses on a nerve. Are you with me? It causes pain all the way down your leg, and we think, well, it's old age, it's trauma. Maybe. But lumbar arteries are sometimes blocked by the time you're 18 to 20 years of age. We see this very commonly. So how am I going to protect my arteries? How am I going to keep them open? And how am I going to reverse blockages that are already there? Well, the first thing is we want to avoid the animal fat and cholesterol. This is what Dr. Ornish was talking about. And this doesn't just mean avoiding the chicken fat and the beef fat and the pork fat. Dairy fat, too. If I have a chunk of cheese, you can't pour it like a vegetable oil. It's solid, right? That's a sign that it's loaded with saturated fat. What about fish oils? Well, people say, well, fish fats, they're good for my heart because they've got omega-3 in them, I guess that is. Well, you know, that's true. Fish oils do have some good fat. Those are the omega-3s. But that's only about 15 to 30% of the fat. The other, 70 to 85% of the fat in fish is plain old saturated fat. That's the bad kind that raises your cholesterol, or various kinds of unsaturated fat that do nothing other than supply extra calories for us. Now, this is for extra credit. Cholesterol and fat are not the same thing. If you set the animal products aside, you're getting no animal fat, you're getting essentially no cholesterol, and it has a dramatic effect on your blood cholesterol test, and it actually helps many people avoid cholesterol-lowering drugs or gradually come off them. So, avoiding animal fat, avoiding cholesterol, that's important. One more tip, though. Let's keep all oils to a minimum. Now, you've heard about partially hydrogenated oils, trans fats. You'll see these sometimes on the label. You want to avoid those. Those are as bad as any kind of animal fat. But all fats are mixtures. Let's say I take olive oil. Well, it's certainly better than chicken fat or beef fat, but it's about 14% saturated fat. So that's better than those, but it's not as good as zero. So it's really good to keep all oils low. If I set the animal products aside, minimizing the oil, it really has a dramatic effect. One other thing, certain foods actually have a cholesterol-lowering effect. At the University of Toronto, Dr. David Jenkins looked to see what would happen if you emphasized these foods in people's diets. He started with a special vegetarian diet, and then he emphasized oats, barley, soy products. All of these have been shown to have an independent cholesterol-lowering effect. And what he showed was that with these diet changes, LDL cholesterol, low-density lipoprotein, bad cholesterol, it dropped by about 30% in 4 weeks, which is essentially what medications could do. So the effects of a diet change are very powerful. Setting aside the animal products, keeping the oils low, emphasizing these foods with special benefits, it's terrific. Now, we also want to be non-smokers, right? Tobacco is not good for the heart. Being a non-smoker is very good for the heart. And you also want some physical activity. But on the other hand, physical activity doesn't actually do much to lower your cholesterol. There are a lot of folks who think, well, I'll just exercise. You can't exercise the cholesterol away. The LDL and total cholesterol don't fall very much with exercise. But what exercise does do is it boosts HDL, high-density lipoprotein, the good cholesterol. Exercise will boost it a little bit. Now, let's tackle high blood pressure. For a lot of folks, their blood pressure is creeping up over the years. They're using medications to take it down. Well, normal blood pressure should be about 120/80 or less. And if it's above that, it can be rough on your heart, but it's also rough on your brain. If you have a stroke, it can be rough on your kidneys. So medications can be essential. They can be life-saving, but they have side effects too. So if you see your doctor and say, what can I do with a diet change to get my blood pressure down? What will the doctor say? Well, let's limit salt, right? That's a good idea. What doctors are saying now is no more than 2,000 milligrams of sodium in the course of a day, or some are saying 1,500 or less. Let me show you what that means. Here's a teaspoon. And 2,000 milligrams of salt is about that much. That's all you get in an entire day. So it really means being very, very careful and really excluding added salt from most of the things that you eat. But that effect is really not very great. When people go on a low-sodium diet, as some of you may have done, you probably found that it didn't make your blood pressure plummet. Am I right? Well, let's go a step further. When people emphasize vegetables and fruits and beans and whole grains, their blood pressure really comes down often very dramatically. Well, why would that be? Well, the first thing is you lose weight. These foods help you lose weight. And if your body is smaller, you're going to find that your blood pressure comes down too. But there's more to it as well. When you set aside the fatty foods, the animal fat in particular, your blood becomes less viscous. When I say viscous, I mean less thick. Your blood becomes more like water, less like grease. So it flows through the arteries more easily. The heart doesn't have to push so hard. Are you with me? So when I set the fatty foods aside and I eat the healthy vegetables and fruits, my heart doesn't have to work as hard. So blood pressure comes down often very quickly. Now, even so, high blood pressure can be dangerous. So don't throw your medicines away on your own. Talk with your healthcare provider, and you can come off your medicines or reduce it if and when the time is right. Let's talk about diabetes. Diabetes threatens your heart. It threatens your eyes, your kidneys, your extremities. And the average person with diabetes loses about a decade of life. Diabetes means there's too much sugar in the blood, right? that sugar is glucose, and as I mentioned earlier, glucose is a fuel for the body. And the common form of diabetes, type 2 diabetes, used to be called adult onset diabetes. That's a condition where there's too much fat accumulating in the cells. This is the fat I was describing that interferes with insulin's ability to get the glucose into the cell. So if I make a diet change, it directly tackles this problem. I'm setting the animal products aside, I'm keeping the oils really low. The fat can't get into the cells, so what happens is the cells are cleaning out that fat that they've accumulated. The insulin can work again. It can escort glucose into the cells very easily. This is more powerful than even the typical diabetes diets that people have been using, where they have to count carbohydrate grams and count calories. It's so tedious. For a lot of people, they're not getting really great results with it. When they go to this simple plant-based diet, they set that aside, and the results are so much more powerful. It's a bigger improvement than we see even with common oral diabetes medications. It's easier, too. You're not counting things. But again, these are serious conditions, and be sure to talk with your doctor before you make any kind of changes. We published our research results in Diabetes Care, in the American Journal of Clinical Nutrition, and elsewhere, and we showed that many, many people improved dramatically. Now, not everybody can reduce their medicines. Not everybody can come off them, but some do. And sometimes the results are just amazing. I'd like to share with you the story of Rosa, who made some pretty big diet changes to tackle a very serious problem.
I weighed close to 250 pounds. I mean, I didn't want to admit it to myself, but it was quite harsh to look at that scale. I didn't feel good. I wasn't sleeping well. The old me was not only embarrassed to go out because I didn't have much to wear, but also just didn't feel comfortable with myself. So I had the whole 9 yards, you know, the blood work, all of that stuff. And she gave me a call, and it was her on the phone versus our nurse, and said, we need to talk. So when I went in, she explained to me that I had diabetes, and she told me that my cholesterol was way up, everything was up, my triglycerides. She said I was gonna have to go on 5 different pills. I said, wait a minute, hold on. I said, my daughter, before I came to see you, had told me that there is a plan out there that's vegan, and then it's been proven that you can get diabetes to go into remission by trying this plan. Could you please give me an opportunity to do this without having to go on all these pills? So I believe it was maybe 4 months when I went back to see the doctor, and he was floored. I mean, I had already lost like 80 pounds by the time I saw him. He just looked at me and said, what did you do and how did you do it? He said, because I've never, in all the years that I've been a doctor, seen anybody do this. And so then I explained to him that I had gone on this vegan program. I know that that's what got me to where I am today. For me, I think it was 20 years ago that I had actually felt as good as I do today.
Rosa set the animal products aside. She kept the oils to a minimum. And if she walked into any clinic today, nobody would ever know that she'd even had diabetes. When people have done research studies of this type and have compared the kind of diet that I've been describing, the results are now clear. And the American Diabetes Association, starting in 2009, said it's safe. And in 2010, their clinical practice guidelines said it's not just safe, it's got real benefits.